Hello, my name is Kevin Bryant, and I'm the Vice President of Human Resources at Aspire Health Partners. I would like to talk to you today about racial trauma and how we can empower you to cope with or support someone who's struggling with racial trauma through the pandemic. Did you know that mental health and well-being of people of color across Central Florida and beyond is negatively affected by the disproportionate impact of COVID-19 in our minority communities? For example, did you know that in the minority populations, there's a higher risk of COVID-19 nationwide due to limited access to health care and health disparities? News covering incidents of police brutality and racial violence, coupled with the staggering rates of lives lost at the hands of this deadly virus and lethal substances, all compose people of color to racial trauma, even if they don't experience this trauma directly. Racial trauma refers to the mental and emotional stress inflicted when encountering discriminatory or racist acts, either directly or through our personal experiences of someone who's close to us. It can be through exposure of news or infraction against someone you love. This stress caused by witnessing racism can have people of color in our community feeling angry, depressed, or fearful about the safety of their children and families. Today, I will share 4 tips of how you can cope with or provide help to someone who's processing racial trauma and COVID-19. First, we must acknowledge how racist events may have impacted you personally. Race-based stress can come from a variety of different experiences, from workplace discrimination, from microaggression, from recent news coverage of police brutality and racial violence. Exposure to racism may leave you feeling especially emotionally shaken or unsafe in this year. Symptoms of racial trauma may be emotional, or they may present themselves in sadness or anger or self-hatred. It may also have a physical dimension and increased heart rate and muscle tension. Some people of color in Central Florida may not even realize that they're in pain. They may repress or push through their feelings due to cultural stigma surrounding mental health in the Black community. Regardless of how you are reacting to racial trauma, it is vitally important for people of color to understand that their feelings are valid. Secondly, limit your news consumption. Now, this doesn't mean to stop watching the news, but constant headlines about racist acts can emotionally be exhausting and trigger those who have experienced trauma to go deeper into some other mental anguish. Although it's essential for all of us in our walks of life to remain informed, especially during these critical times of our nation's history, we must also remember to reserve some time to disconnect from the news and social media to effectively manage your mental health during COVID-19. Thirdly, find a safe environment to express your feelings about racial trauma. If you feel that you have a safe environment to do so, share your feelings and experiences with a trusted person. What's a trusted person? Perhaps a family member, a friend, or an ally. Somebody for social support. Some people of color in a community, it may feel uncomfortable sharing these feelings due to the stigma surrounding talking about race out of fear of judgment or ridicule or even worse, violence and retaliation. To our allies on the outside of the minority community, if a person of color reaches out to you to share their experiences with you, it's important that you listen to them with an open mind and heart of understanding. If you do not feel that you have a safe way to socialize your experience, you may simply write them down in a journal or explore other ways to express yourself, perhaps in a journal or poetry or painting. Through it all, remember that we will get through it together, as Aspire Health Partners and others in the behavioral health profession are here to help you through. Thank you.